Hello, my name is Dr. Brian Shiluli. I'm a medical officer, and today we are partnering with Ponea Health, and we'll be talking about breastfeeding, a very interesting topic. Yeah, there are possible health complications to people who don't breastfeed. In this case, we are talking about the mother and the child. So for the child, they're not going to grow well because they'll not receive adequate nutrients from the breast that they're supposed to get. And then number two, they're likely to get a lot of infections during early life, majorly gastroenteritis, pneumonia, and also they have failure to thrive because the breast milk contains a lot of antibodies and enzymes that help your body to gain good immunity and also to prevent you from getting those infections. Those are the major worries we get in the babies. Then for the mother, there are many complications we'll get worried about because breastfeeding protects you from getting breast cancer and ovarian cancer. So if you don't breastfeed, your chance of getting breast and ovarian cancer increases. And then number two, you have a higher risk of developing diabetes type 2 if you don't breastfeed. Or those who have diabetes, they tend to have more demands for insulin, so you have to increase their dosages for insulin. And then those other people suffer from metabolic syndrome, and then others will yes, again, breastfeeding gives you something we call lactational amenorrhea, which basically means that for a period of 6 weeks, you are not able to get your period. So it gives you a duration of contraception without necessarily using any other medications. But this only applies to mothers who do exclusive breastfeeding alone. So the support you can give to your spouse to help them have good milk production or who are breastfeeding, especially if it's your spouse or someone you stay with, is to help them develop a breastfeeding plan for themselves so that they can be reminding themselves every single time. And then also help them to do a good follow-up with their healthcare provider so that we don't have any disparity in whatever you agreed with the partner and the healthcare provider. But again, remember we said that social support plays a very big role in breastfeeding. So we want you to support this mother during that period of breastfeeding, be there with them, encourage them, and ensure they need whatever they need, they're given. Yes. So we are living in a very dynamic society where we are busy, occupied at our workplaces, and we don't get enough time to spend with our babies. But we have seen all the benefits of breastfeeding, and we encourage all mothers to ensure that they have enough time with their young ones for at least 6 months to do exclusive breastfeeding before they introduce other supplements. And then to ensure they also adhere to the schedule for breastfeeding at least 2 to 3 hourly, and then ensure you feed the baby adequately so that you don't have any lapses in between. Thank you so much for joining me in this episode and discussion. You can book my services through ponea.com. Thank you.